All right. Good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Tonight, I'm talking about zinc deficiencies, taking zinc as a cause of spinal cord pathology. So why is this poignant? In essence, this is 2020 in the year of the pandemic. And with the pandemic, a lot of people are talking about immune boosting supplementation. I even talked about the supplements that I take on a regular basis a while back, and zinc is part of the formulation for a lot of these immune boosting supplement protocols. Zinc is widely talked about in the literature to help promote a healthy immune system and prompt a response by our immune system to battle viruses. And good evening to everybody who's joining. So, with that being said, a lot of people are taking zinc right now. And it's important that if you're taking zinc, or let me say it this way, what I'm recommending to all my patients who are taking zinc, I'm recommending that they take copper, because zinc and copper, in essence, competitively inhibit each other for a transport protein in the intestinal lumen. And so if you're taking a lot of zinc, you may develop what's referred to as a zinc overload syndrome. And when that occurs, then as a result, your copper is going to be low. Copper deficiency is a really bad thing for the nervous system. It also can cause anemia. And so if you present with signs of low white blood cell, low red blood cells and low neutrophils, neutropenia as it's termed, then you may actually have a copper deficiency. In fact, patients who are diagnosed with something called a myelodysplastic syndrome have been found in some cases to actually just have a copper deficiency. Taking copper in these situations will help the signs of anemia. If it's caught early enough, taking copper can help the signs of spinal cord pathology. And the way this was figured out was many, many years ago, in the 1800s actually, where zinc smelt workers in northern Germany at that time, which is now southern Poland, they were observed to develop sensory symptoms. So they were developing like numbness and tingling in their feet, and then they developed this stiffness in their legs, and they became weak. And this one researcher basically noted that they had signs of spinal cord pathology. An article came out in 2010 documenting, I think it was 55 cases. I think it was out of the Journal of Neurology, 55 cases of taking zinc or other situations that would result in a copper deficiency. And these 55 individuals were found to have copper deficiency causes of spinal cord pathology. The interesting thing about this whole notion of when we take too much zinc and then we develop this copper deficiency is that the spinal cord problem presents very much like a B12 deficient. Myeloneuropathy is this termed, or myelopathy. It's also referred to as subacute combined degeneration of the spinal cord, or in the back half of the spinal cord, one will see signs of inflammation, basically, and where we transmit sensory signals, particularly for vibration from the feet and the hands, as well as the position of our joints. So, what's the take-home point? If you're taking zinc, you want to be taking copper. That's important, and if you want the ratio, you can contact our office. I'm not going to give widespread medical information out there. I'm just saying, in general, if you're taking zinc because you're worried about getting viral infections, you probably want to be taking copper with it so that you don't develop a copper deficiency. And that's the take-home point. Other conditions that can cause copper deficiencies most commonly include gastric bypass situations, or if someone has let me say it this way, where they're not able to absorb their nutrients. So if you have like celiac disease or ulcerative colitis or Crohn's disease, particularly if the Crohn's is affecting the upper intestine, then you can develop what's referred to as a malabsorption syndrome. So that's the word I was looking for there. Copper deficient spinal cord problems tend to affect women in the 5th and 6th decades. I think that's also important for all of you to know. And so So yeah, so if you have any other questions on this, shoot them to me. Let me just go through the comments. Hang with me. Okay, hi to everybody again. Oh, thank you so much that all of you are enjoying the information. Okay, and tomorrow night I'm going to be talking about Hashimoto's thyroiditis. So I haven't really talked about Hashimoto's in years, just because we're primarily neurologically focused. But I still deal with a lot of autoimmune diseases, and because Hashimoto's is an underpin for so many conditions. I mean, I treat Meniere's disease patients who have Hashimoto's, and benign paroxysmal positional vertigo patients who have Hashimoto's, and I work with Hashimoto's that by itself. So I'm going to do a video and talk about the newest information on why the immune system is spiraling out of control and affecting the thyroid of so many people. Particularly, there's a female preponderance. I mean, I've read some studies that indicate 1 out of 3 middle-aged females have Hashimoto's. You'll read other research that says 5% of females have Hashimoto's. But it depends on the age demographic you look at. We'll talk about environmental factors as to why it's so much more common now, because genetics haven't changed. We'll do an update on viral infections in the thyroid. So I think it should be pretty action-packed. Yeah, so it should be good. So again, if you're taking zinc, you want to be taking copper. If you have questions on the exact dosages and you're a patient of mine, call our office tomorrow. If you're not a patient, you can message us and we can figure out how to maybe give you some information or not. So anyways, that's it. Have a good night, everyone. Talk to you later.